Ever wonder why some celebrities literally look like they're never aging? You look at them in their 50s and 60s and they look just like they did back when they were in their 30s. A lot of you think this is because of some secret set of procedures that only A-list celebrities have access to, or there's some elite skincare they're using, or they have some amazing genes. The fact of the matter is, it's a lot more complex and a lot more simple at the same time. Today, I'm gonna walk you through why some celebrities look ageless, while other celebrities look like they've been overdone or look totally different as a result of plastic surgery. And after 20 years of helping people look as young as they feel, I've got some answers that you're gonna find very interesting to the common questions that many of you have been asking about this very topic. Hi everyone, I'm Dr. Amir Karam. I'm a board certified facial plastic surgeon and the founder and creator of Karam MD Skin. And today we are going to crack this nut and get really into the depths of procedures and approaches the celebrities use to look as young as they feel, and why it really matters in their line of profession and what we can learn from both the positive things that they do as well as some of the mistakes that they make. And keep in mind that anyone, including celebrities, their top priority is to look like themselves, youthful, and not look like they've been overdone or look unnatural. But yet, sometimes mistakes happen, and we're gonna learn how to avoid those mistakes. Over the last 20 years, I have treated many people in this category, celebrities, people of influence, etc. And I can tell you that the awareness and the pressure to look young from a professional point of view is very real. Oftentimes this leads to the desire to do procedures, some of them timely, some of them too early, that can lead to great outcomes if it's done properly in the right setting and the right time, as well as lead to many of the outcomes that you have seen that make you wonder, how come so-and-so didn't get this right? Why do they look the way they do? And if they can't get it right, how in the world can I get it right? One of the fundamental problems that I can shed light on is that treatments like Botox, fillers, different types of RF microneedling procedures to tighten threads, mini lifts, etc., all these different things done in a piecemeal fashion, starting in an early stage of life to basically ward off aging, oftentimes lead to imbalance and an appearance that starts to look more and more different as time goes on. And we've all seen that effect as well. The problem with a piecemeal approach, and many of you have heard me allude to this in the past, is that aging doesn't happen in pieces. It happens holistically. There's a number of different areas that are happening simultaneously. And using individual procedures to address one wrinkle at a time, one part of the face at the time, doing an upper blepharoplasty, not doing the lower blepharoplasty, treating the jawline but not treating the neck, all of these things lead to disharmony and imbalance and overall an unnatural look. In fact, some celebrities simply start this process too early. We see this with our patients as well, who want desperately to prevent the aging process from occurring, to be able to retain their appearance and retain their youthful look so they can continue, looking like themselves and getting the parts that they're used to getting, etc. But next thing they know is that there's a drift further and further away from what they used to look like, and suddenly they become dysmorphic and distorted. And those are the things that we're gonna learn from and how to avoid those. Because the last thing anyone wants, including the celebrities, is to look different and to look like they've had work done. Because there's a stigma associated with that, and it certainly isn't something that is desirable or wanted. It happens by accident. Let me be clear. Everything that I'm about to share is based on public observation as well as my opinion as a facial plastic surgeon. I don't know the exact procedure that any of these celebrities have had done. My goal here is education, not judgment. These public images are widely discussed and widely displayed, and they're gonna be used here to discuss what works and what doesn't and what we can learn from them. All right, so let's start with some positive examples, some balanced rejuvenations. Let's take somebody like Halle Berry, Jennifer Lopez, Sandra Bullock. These are people that have been put into the limelight as examples of ageless beauty that literally is defying the natural rate of aging. People who are in their 50s but yet still look very youthful. Now, my strong opinion is And I'm not talking about these people specifically. However, generally speaking, people who are in their 50s usually have an onset of aging changes that are not going to be addressed with skincare, Botox, fillers, etc. That's typically when laxity starts to come into play. And normally people who are in that particular age range have had work done if they look like they've got pristine looking jawlines and necks. These could be very beautifully, elegantly done deep plane facelifts, subtle fat transfers, upper and lower eyelids, etc. In the end, preserving the person's identity and overall youthful essence without changing it, but usually it requires deeper structural work and not just superficial treatments. And this is why these examples in particular, these people look refreshed or fresh, and they don't look different. They look like themselves. Okay, now what about the overdone or unnatural look? A common example that has come up many times is Madonna. Again, all speculation. I'm not going to say what she had done or hadn't done, but the assumption is that the change in her appearance from youth to where she is now is mostly because of volume, fillers, etc., that have been done too aggressively. And as a result, you can see that her face does not resemble what it used to look like. And that is considered one of the warning signs, some of the things that people show as an example of what you want to avoid when you're using fillers, etc., because the last thing you want is to, again, look like a different person. What we want is to look like the youthful version of ourselves, not like a revised version of ourselves. Courtney Cox was so transparent and forthcoming about her own experiences with fillers. She talked about how she went a little too far with them and started noticing her face was starting to change and morph, etc. And she shared that experience with the public, which I thought was really, really great and very helpful, because hearing from celebrities and influencers is how other people are going to learn. And when people share their experiences honestly with us, that's where the information can get transmitted in a way that we can actually use. Now, how about starting too early? There's a difference between cosmetic and restorative, and I've always made that distinction very clear. Cosmetic procedures are designed to change your appearance. They're designed to make you look like a different person. So things like cheek implants, rhinoplasties, chin implants, these things are meant to create form that didn't exist before. Restorative or preventative procedures should not create a new look to your face. And so many times we see young influencers, actresses, models, etc. Some that come to mind are Bella Hadid and Kourtney Kardashian, for examples, that where their face, no judgment of it looking better or worse. These are beautiful women, but they don't look exactly like they did before. So the assumption is they had some cosmetic procedures. And this is where things like, again, the rhinoplasties and the cat eye procedures and buccal fat pads and a number of different things can truly affect the facial shape. These are totally different procedures with totally different goals than rejuvenation procedures or preventative procedures, preservation procedures that are designed to maintain or restore the appearance. Restorative and preventative procedures should not change the appearance. In general, if you are on the younger side and you're looking for a change in your facial shape because you want to look prettier or then cosmetic procedures are wonderful. They have a purpose. You just have to understand what the outcome will be, and the outcome will not be looking like yourself. And doing too many of these procedures slowly over time really does shift the curve in a different direction, and many of these procedures do not age well. So you have to be mindful about what you are trying to achieve. And just because a celebrity gets a couple procedures done, like buccal fat pads is a great example. Buccal fat pad removal was extremely popular at a point in time, and you're getting all these young models, these cheeks are starting to get gaunt looking because that was considered attractive. Next thing you know, that 20, 30-year-old ends up becoming a 40, 50-year-old, and they lose facial volume, and next thing they look skeletonized and very, very gaunt and aged looking. So procedures, when they're done when you're young, can have real impact on how you age going forward. So be mindful of that as you evaluate these things. All right, so here's what people get wrong. They focus on the superficial stuff. Fine lines, wrinkles, the stuff that's happening at the top of the skin. And we're gonna talk about what you have to do for those problems in a moment. But the real aging And the real preservation and restoration of aging is happening at the fascial level. It's happening at the ligament level, it's happening at the bony level. These are deep changes that are occurring. And the treatment and the basis for my facial rejuvenation approach, the vertical restore, fat transfer, subtle eyelid rejuvenation, that's all happening at the deep level. We are repositioning the soft tissues back to where they were, and as a result, getting the facial shape to retain its youthful look, its natural look, or to restore it back to where it was. When these components are all done together, when you're addressing the lateral brow, mid-face, jawline, and neck in one fell swoop like you are with a vertical restore, addressing fat around the eyes, the mouth, the lips, temples, all together, and taking care of the upper and lower eyelids simultaneously. When you're doing it this way, what you're getting is a balanced, natural-looking result. And that's what people want. No one wants to look like a different person. They just want to look like themselves, natural, unoperated, looking as young as they feel. And here's something to keep in mind. I've literally seen thousands of patients spend thousands of dollars on all sorts of non-surgical treatments to try to avoid having surgery, only to realize that you can't and eventually need the surgery anyway. So save yourself that trouble, save yourself that cost, save yourself the risk in the recovery and all these other things that are associated with it, and just recognize that this is the direction that you need to go. The real secret to aging well is timing, consistency, and the right plan. Let's start with your skin. Something that everyone should be focusing on at any age, and trust me when I say this, celebrities do this quite well, is proactively managing the aging changes that are happening to your skin. And I've shared this with you before. What are those things? Things like sun protection, retinol, vitamin C, niacinamide, peptides, ceramides, lipids, hyaluronic acid, lighteners, all these things rejuvenate skin and make it look better over time. All of those things are things that I decided to put into the Karam MD trifecta. For those of you who are interested in doing something that's completely comprehensive, super simple, and unbelievably effective, check out the Karam MD trifecta. But in the end of the day, consistency is extremely important, because if you're not doing skincare on a regular basis, your skin's not going to change. And this is one of the things that I've talked about when I've talked about other celebrities, is how much I applaud the consistency and the focus that they've had on their skin, because they get it. They recognize that you can't look young if you don't have young looking skin. And youthful skin requires a lifetime of focus and attention, because natural aging is taking you in the other direction. Additionally, you need to support healthy habits, getting good sleep, getting good hydration, getting good nutrition, having a low stress life. These are all things that are going to help keep your skin and your soft tissues in the best shape possible. But they're not going to keep your jowls from forming and your neck from getting lax when the time comes. And this is important, because you can do all these beautiful things for your skin, but it's not going to change the fact that when the time comes, hormone related, whatever it is, laxity is going to happen. And when it does, that's where you employ surgical techniques, deep plane faces, vertical restore, fat transfers, etc., to address those things. So what about timing? Let's talk about that for a second. Skincare is something you should be doing from day one. The sooner you get started on that, the better, because the effects are cumulative. Skin gets better year over year as you're using these proper ingredients. People who have been on the trifecta for 2 or 3 years, their skin is flawless. And that is what is so important to get across. People don't understand that aspect. That goes your whole life. Sun protection your whole life. When should you do a procedure? Well, that depends on your biological aging. If you are somebody who's in your early to mid 40s and starting to see changes happening, well, then that's when you want to do it. And this is when celebrities are getting some of these procedures done. When they start to notice changes happening to the laxity of the jawline and neck, and they want to prevent that from getting too far along, they'll pull the trigger and do it. They'll get a facelift, they'll get fat transfers, etc. The typical age for most people, as I mentioned, happens in the late 40s and early 50s. This is when almost everyone, 90-something% of people, show signs of aging. And this is where if you see somebody in that age group that looks amazing, you can expect that they've had work done and they've had surgical work done. That's how you play it. You do skincare your whole life. You do some Botox to keep fine lines and wrinkles around your eyes from forming. And then when the time comes, you pull the trigger and you have a lift. You don't need to do lots of fillers. You definitely don't need to do threads. You definitely don't need to do different types of technology and all these other things. It's that simple. The plan is basic. but too many people overcomplicate it and get too zealous with procedures and different things, which ultimately ends up hurting them more than helping them. And it's important that you link up with a surgeon who respects restraint, that appreciates harmony, that appreciates the process, because the last thing you want is being treated like a piecemeal, like every 6 months, come back and let me do something for you, let me do this for you, let me do that for you. That's going to cause all the problems that we just talked about. And keep in mind, everything that we're talking about here applies to men as well. This is not just a woman's problem with aging. Men age in the same way. Timing is a little bit different. We don't have the same impact with perimenopause and menopause with changes in hormone, but the fundamental aspects of aging exist in the same way, and men and women ultimately benefit from this basic plan. All right, there you have it, my friends. That is the secrets that are not such a secret to how celebrities stay looking young, some of the mistakes that they make, and how we can avoid those and learn from them, both in terms of what they do right and what they do wrong. So if you've been thinking about facial rejuvenation and don't want to look different or done, this is what I do every day. This is my claim to fame. This is why patients travel all over the world to see me for surgery. This is the approach that I use. If you're interested in a consultation or to learn more, check out our website, check out the consultation section if you want to make an appointment to talk with me. If you haven't already, make sure you subscribe. If you enjoyed it, make sure you like it, send it to a friend and family. If you have any questions or comments, drop them in the section below. I always do my best to read them and give as many replies as I possibly can. Until next time, Dr. Amir Karam.